Hi, and welcome to Rebel Roots Nutrition. I'm Carla, your host. I'm a nutrition therapist that is board certified in holistic nutrition. I also am a certified postpartum doula, and I have some extensive background in early childhood education. I've created this space to discuss nutritional topics related to preconception, pregnancy, postpartum. This information that we'll discuss here is strictly educational and is not intended to diagnose, treat, or replace any medical advice. So I hope that you enjoy it. Let's get started. Welcome, Dr. Horton. Super excited to get to have this conversation with you today here on the Rebel Roots program. I've been kind of looking forward to it all week, but so we're going to discuss today a preconception checkup and what that looks like. And if we have time, we'll get to maybe some additional testing to consider in the early stages of trying to conceive. But first, I'd really like you to introduce yourself, if you wouldn't mind sharing your background with the audience.
Yes, absolutely. Yeah. Thank you so much for asking me to speak on your podcast, Carla. And it's great. You know, we just for some context, we practice together at Sattva Health and Wellness in Lakewood, Colorado. And it's a great group of all female practitioners, believe it or not, who want to see women be healthy on all levels. So my kind of journey, I'm a family medicine doctor by training, going on almost 20 years now. And since 2019, I've had my own integrative functional medicine practice. And really, women over my career had always been asking me, are there other things I can do besides the pill? Are there more natural approaches? And honestly, your typical conventional doctor, that's not the main focus of our training. We're there to diagnose and treat. So I found myself just doing the extra homework, doing the extra conferences so I could have those answers for my patient. And when I found functional medicine, it was like opening the box that I could not put back on the shelf, because really the goal is to figure out what the root cause or causes of whatever the person is coming to me for, a symptom, a disease process. There's always a time and place for a pill or a procedure or a surgery, but many times that's not the answer for the person. And so I found that functional medicine helped me fill in those holes and those gaps that patients were kind of feeling in their typical conventional appointment.
Absolutely. That there's such a need for this work.
Yeah.
So, yeah.
And my focus has been with women and hormones. And often we think estrogen, progesterone, testosterone, but there's other hormones. There's cortisol, there's thyroid, there's insulin. So I help women kind of figure out which of their hormones are out of whack, out of balance, bring things back into balance so that they ultimately find their ideal weight, energy, mood, and sleep. I mean, it's always back to that. You know, people just want to feel good. We want to age gracefully and know the best ways to do that.
Wonderful. Thanks for that information. So today we're going to talk about what a preconception checkup looks like. And I love this because, you know, I think back to before I got pregnant and my mind was not there. And I don't think that, for whatever reason, we're just not taught to think that way. Like, how could we prepare our bodies to really be ready to conceive and have the best possible outcome to have a baby? So, I guess the first question that comes up is, who's doing this, or who can do this?
Right. So ideally, and I even brushed up on the official recommendations from the American Academy of Family Medicine doctors, but really a good primary care physician, preconception planning should be part of any interaction, right? You're always assessing health risk factors, making sure you're up to date on various health maintenance things, checking in on risky lifestyle behaviors, all things that could impact, a healthy pregnancy. And the other statistic is, most pregnancies are unintended. So people don't have the luxury of saying, I'm going to go in for my preconception checkup. So ideally, we should be kind of peppering that into our regular visits, but we also know how fast those visits are, and there's often not all the time to do those types of things. So, really your family medicine doctor, your OBGYN, a midwife, they would all be appropriate healthcare practitioners, a nurse practitioner, in family medicine or gynecology, to, just assess where you're at. And it's just the traditional things. We're often just making sure, do you have any medical conditions, pre-diabetes, high blood pressure, asthma, anything that might impact your ability to get pregnant or be a risk factor should you get pregnant? Are you on any teratogenic medications? There's certain blood pressure medicines, seizure medicines, even antibiotics that are associated with birth defects. Obvious ones: smoke, drink, alcohol, illicit drug use, immunization status. Often we will check antibody levels to like measles, mumps, rubella, chickenpox, because if you're not immune to those things, you need to be immunized for them before you get pregnant, because these are live vaccines and you can't get that vaccine if you're pregnant. So those are just, kind of the things that, again, we ideally should be touching on anytime we see a patient or at your checkup, but those are the highlights that you'd want to make sure have been checked off before you get pregnant.
Okay, yeah, and which makes so much sense, right? I mean, we want to make sure that the mom isn't pre-diabetic, where she might end up with gestational diabetes or high blood pressure that could lead to preeclampsia and conditions like this. Is that, yeah.
Yeah.
Okay. What about other testing? I mean, is it normal to look at folic acid levels, that kind of thing? Or is it really just the recommendation to be taking a prenatal? I mean, is that, yeah.
The evidence-based answer is everybody should be getting at least 400 to 800 micrograms of folic acid a day. I think you can get that in a prenatal vitamin quite easily. You're also getting some good omegas in that probably. But that's where the evidence stands. We don't have any guidelines saying we should be checking folic acid levels. And honestly, I even just ran through this to see if anything had changed. Really, there's no labs that everybody should be getting before you get pregnant if you don't have any risk factors. I mean, maybe if you've been anemic before, we should check a CBC. Certainly if you're hypothyroid, we're going to check TSH. But there's really no, labs that, everybody who wants to get pregnant should have checked. I mean, if you're overweight, we should probably be looking at your cholesterol and your blood sugar and your A1C, for example. So it's really more driven by the patient's personal history versus just saying everybody should get these labs from the conventional standpoint.
Okay. And what about, advanced testing, like maybe looking at genetic issues or looking at prior history of maybe miscarriage or just delivery, preterm delivery, that kind of thing? Are these also assessed and talked about in the preconception?
Yeah, absolutely. To me, that would be part of that kind of whole past medical history, family history, risk factor assessment. So yes, if there were certain genetic disorders, cystic fibrosis, there's genetic testing and screening. You can do that, for example. It would just be really driven by the patient's, personal and family history as to what lab testing and kind of next step would be.
And then that's when they would get sort of referred out to the specialist person.
Right.
Yeah. Okay.
Right.
Okay. Wonderful. Could you talk a little bit about so I guess at what point might you, and we wouldn't go into that specific testing today, but at what point might you start looking at, other labs?
Mm-hmm.
Would it be after trying for a certain length of time and you're starting to feel like, maybe there's something else going on here?
Right. So officially, I would look at, and this is my approach if I was working with somebody, I would take like 3 months just to kind of clean things up in your life, assess, over-the-counter medicines, prescriptions, your diet, sleep, alcohol exposure to toxins. Yes.
Just to clarify, Dr. Horton, this would be more of the functional approach to it, correct?
This would be more of a functional approach, but to me, you could do this on your own too before you go in to your doctor as well. So I want to give you some things that that people can be proactive about as well. So so 3 months before you actively start trying. Okay. The definition of infertility is a year of unprotected intercourse, having intercourse at the appropriate time, a couple days before ovulation, around ovulation is your ideal time. If you are over age 35, though, we shorten the window. Usually we start to, again, looking for, if you're not pregnant after 6 months after age 35, then we might start doing kind of some of this second level testing. So a year for people less than 35 is when we might do some of this testing, and then 6 months for people greater than 35. So the initial labs would be, we might look at a progesterone level at day 21 to start looking for luteal phase defects. Is there something wrong with the corpus luteum, which is part of the egg that, helps you maintain a pregnancy, helps, develop a good placenta and things,
progesterone for you too, right? Yeah.
Say that again.
So producing the progesterone essential to thickening the line. Okay.
So that would be an initial lab, a thyroid test, TSH lab, a prolactin level might be checked at this point, an FSH level to assess, is there any ovarian failure or insufficiency going on? I mean, are your ovaries, even pumping out the eggs? Or an estradiol level, it might also be one of those initial labs. So that's, again, kind of the initial cluster of labs that your primary care physician even could initiate, or OBGYN.
Would you at the same time, would you also do a sperm analysis at that point?
Yes. So at that point, sperm analysis would be a good idea as well, because, right, it's not just, it's not on all our shoulders, right? Technically 40% of infertility cases, it's a mixed issue. It's not, the man and female. So yeah, sperm count at that analysis would be important as well. And it's important for a sperm analysis that, it takes about 100 days, is a life cycle of making healthy sperm. So again, the man kind of needs to do maybe some cleanup as well, even before that sperm analysis, I would argue, and before actively trying to get pregnant.
Okay. So about that same 90 days kind of.
Yeah.
Okay. Yeah. Great. Oh, this is such good information. Thank you. So I'm not sure that I have any other specific questions around this. I think this is like a really nice start for those early stages of we want to have a baby, maybe we're not sure when exactly that's going to happen, but we just want to make sure that our bodies are, prepared for it, kind of like tilling the soil, so to speak. But is there anything else that you wanted to add?
Yeah, I think looking, at the big category of stress, because that can just impact so many things. And there haven't been any, randomized double-blind placebo-controlled studies to show that when we work on stress that we improve fertility rates, believe it or not, even though probably anecdotally we can think of scenarios where, people were trying to get pregnant or in a fertility situation, and when they just stepped away from it all, right, and their bodies relaxed, they ended up getting pregnant. So because we know stress impacts so many issues and diseases, I think kind of starting there is important for a lot of people, because often if their stress is off, maybe that's when they're not eating the right things, or they're drinking more alcohol, or their sleep isn't, very good, or all these different lifestyle things that impact the ability to get pregnant and having a healthy pregnancy can kind of flare up when we're using them to control our stress. So I think looking at the overarching category of, stress management, where am I at, is,
and how able to manage that. Yeah. Awesome. Well, I really appreciate your time today. Where can people find you?
Yes. So my website is easy. It's just drjenniferhorton.com, no periods, no spaces. And again, you can just get a highlight of one-on-one work with me. I have a couple of group programs, have some other informational resources on that website as well.
Awesome. Thanks so much, Dr. Horton. I appreciate your time today. And I'd love to have you back on so that maybe we can dive into some other topics as well.
Yeah, we'll be happy to speak to that. Thank you for having me. Appreciate it. Yeah.